Welcome. Welcome to our podcast, Clinic Mindset, the podcast where strategy meets care. I'm your host, Dr. Edisa Shirley, Chief Growth and Mental Health Officer here at ClinicMind. I have a pleasure of introducing one of the great guests. She's also a great friend of mine, Vasanta Pundarika. Vasanta is a healthcare social advisor and strategist who spent nearly 2 decades in investment banking, supporting healthcare service organizations. And today she works closely with founders and executive teams in behavioral and women's health, helping them make decisions that drive sustainability and protect patient-centered values at the same time. So Vasanta, welcome to Clinic Mindset, and thank you for being here.
Thank you so much for having me, Edisa.
Well, it is an absolute pleasure. So before we dive into today's theme, when strategy meets care, I would love for you to share with everyone just a little bit more about what originally drew you to behavioral health and women's health, and why do you think this work matters so much?
So as you mentioned, I've been in healthcare 20 years now, and I started off working with hospitals and healthcare systems. And it was like maybe 10, 15 years ago, several years in a row, I went to these hospital conferences. While I was there, they had these CEOs up on stage and they talk about what are 5 things that kept you up at night. And every single one of them, these are large healthcare system CEOs, and every single one of them would always say behavioral health in that list of 5 things that kept them up at night. And then later in the discussion, like within that same hour, they would ask them, what are your 3 biggest priorities? And behavioral health was never on that list. And so here's like this mismatch of behavioral health being something that keeps them up at night, but not being on their priority list. For a while, I didn't understand why that was happening until I realized that it's because they didn't know what to do about it. They didn't have a solution. And when I heard that multiple years in a row, I just kept thinking like there has to be something that needs to change in this industry. There has to be some new innovation that comes about. And so I started focusing more and more on behavioral health around that time. And I was not wrong. Behavioral health as an industry has just grown leaps and bounds over the last 15 years. A lot of the innovation and change and technology and everything that you see today is all completely brand new. And I couldn't have imagined it, 18, 20 years ago. And then behavioral health took me into women's health. I was working with a number of different residential care facilities coming out of COVID, and they kept asking me, our men's unit has filled back up and not our women's unit, and we don't understand why. And I'm sitting there thinking, well, a lot of the women that I know are worried about their kids and their spouses and their parents, their spouses' parents, their jobs. And you're asking them to leave that whole ecosystem that they're the linchpin of and go into residential care. By the time they get there, they're going to be drag kicking and screaming in a much more severe case. And this company and multiple companies actually hadn't thought about that at all. And that's just the logistical side. What about the clinical side to that, right? And I realized, we're missing women in behavioral health, and it started making me think, like, where else are we missing women? And it turns out the answer to that question is everywhere. And once you see it, you can't unsee it. In brain health, 67% of Alzheimer's patients are women. Migraine patients are mostly women. Cardiology, heart disease shows up very differently in women than it does in men. Orthopedics, gastroenterology, oncology, just everywhere in our whole bodies, we're not addressing women's health. And so to answer your question, what inspired my focus on behavioral health and women's health, I think the real answer is these are places where I felt like we as an industry, we're not doing enough. We needed more innovation and we needed more change. And as somebody who comes at this from the business side, I really wanted to be there to, create an impact and support those parts of healthcare that I felt like really needed to push forward.
Yeah, that's really interesting. You said that, I come from behavioral health space myself, but anyone that I had a conversation with just over the years, when you ask them what brought him into the space, it's almost exactly the same answer. Like, there's no one that's trying to become a millionaire. There's no one that is trying to make a lot of money. There's, it's always people that are like, there's a gap. No one is solving the gap. People are identifying the gap, but silently. And I've seen that in primary care, urgent care, where doctors are almost scared to provide assessments, PHQ-9, GAD-7, that would screen for some of the behavioral health disorders, because they don't know what to do with them. They don't want to ask.
Yeah. Where does that patient go after they get screened? And a lot of times we ask, physicians that are specialists in one discipline to become behavioral health specialists, which is a different specialty, right? And a lot of physicians don't want to do that because it's not their specialty. One of the decision points or spaces, or I don't even know how to call it, cracks that behavioral health often falls into is whose responsibility is this patient? Where should this patient actually be taken care of, and where should they be? I mean, even think about it from, when you discharge a patient who's a behavioral health patient from a hospital, and they often get discharged with a piece of paper that has a list of different places that they need to go to call for a follow-up for like step down care, but not an appointment. Now, whose patient is that? That patient has been discharged from the hospital. That patient is at home. They haven't actually made any of those calls yet to get on those lists for the step down care. So whose patient is that patient? It's nobody's patient. And that person is now, unless that person makes that phone call to get on a waiting list or get into care somewhere else, that person isn't anyone's patient at that point in time. And that's something that we need to solve.
Yes, absolutely. With that care coordination and integrated care coordination. So there's definitely a lack of that piece, not knowing where the patient goes. And if that is your patient as a primary care doctor or a chiropractor, I've seen that in a chiropractic space as well. So let's say a patient shares with you that they're having some tension or they're having issues in their personal life, and you refer them out.
Yeah.
And that's it. And you don't have an appointment for them, right? You just have a piece of paper that says, hey, go see someone else. But that's what I've noticed, that some of these specialty practices stopped screening patients because there's a liability to okay, you've shared all this with me, and now we don't really know what to do with you because we do not have that referral process that is automated, and that, to know that this patient is taken care of, and there's going to be some kind of communication coming back.
Yeah, it's almost like sometimes people don't want to know that there's a behavioral health issue, because if they don't know what to do with the patient after, then they don't have any solution for that patient. Healthcare companies, physicians, nurses, NPs, RNs, physician's assistants, everybody within the clinical side of a healthcare community, everybody wants to take care of every patient in front of them.
Yes.
And they want to take care of each of those patients to the best of their ability. And when they don't have the tools to be able to do that, it can be really frustrating. And so I think that's why you're seeing some of the lack of screening that you're talking about. It happens a lot in maternal care too. Right before a baby is born, there are so many appointments and so many screenings that happen. And so the mother feels like really taken care of right before the baby is born. In certain instances, in some instances, she might not even feel taken care of at that point. But after the baby is born, there's a 6-week OB appointment. And then postpartum depression shows up in week 7, 8, 9, 10, or even after that. I know some states are expanding it from 6 weeks to 12 weeks, but still, is that long enough? Or should it really be a year or 2 years? And, hospitals can't take on that patient for a year or two. Then whose patient does that patient become?
No, absolutely.
Yeah. We've gone really down this train of whose patient is the patient.
I know. Hey, you know what? It is an important question, but I know you do a lot of work in growth, like growing businesses. So let me ask you something. So why does growth always so often feel like it comes at the expense of a patient experience?
So I think a lot of times people don't realize that, let me put it this way, if you grow a business and you don't have good clinical mission and good clinical strategy underneath that business, that growth gets up to a certain point and then flops because there's no clinical substance behind it. If you focus on your clinical substance and your clinical mission exclusive of growth, then very few patients actually get the impact of what you're actually trying to do. So you need to integrate the two of those together. How do you keep your clinical mission and grow in a sustainable fashion? That's how you can actually impact more patients, because you're going to be around 2 years, 3 years, 5 years, 10 years from now, if you continue to grow in a sustainable way. And I think a lot of times what happens is when people start to grow, they focus really heavily on marketing. We see these like snazzy, jazzy brands out there, like brands that everybody has seen and get really excited about because it seems like they're doing all of this stuff, but they grow and spend a lot of their money on marketing and don't spend money on operations. All of the systems that are in place all contribute to the patient experience. So you can't just hire all of the clinical staff and say, okay, now we have clinical care here, because a patient needs to figure out how to make an appointment, needs to actually get the reminder for that appointment. The patient needs to show up for that appointment. The provider needs to be there for that appointment. They need the follow-up afterwards. They need the next appointment. They need to be able to have access to their records. All of these friction points between, that are all part of the patient experience are all so critical. And when people don't invest in scaling those along with scaling their marketing efforts, they end up in a situation where the clinical care can hold on as long as it can hold on, but when all of these operations and systems aren't growing with it, they can't handle the load, and then both the patient experience starts suffering from both the operational side and the care quality side. And then what is your product? Your product is actually the patient experience, and so you've been focusing on marketing but not on your product. Your product actually needed to grow with your marketing team. And so to me, it's really important that people integrate those two functions and really think about, clinical mission with scalable business strategy. And if they put the two together, they can impact more patients. And it's really important to do that, because otherwise you are creating a growth plan that is separate from the actual product that you're selling. I mean, if we were selling, green clay mugs, and we were trying to market green clay mugs, every single marketing person that was trying to market those green clay mugs would be sitting there with that green clay mug, making sure that it was as wonderful as they're saying it is when they're trying to market it, right? And we forget that in healthcare, that patient experience is the product, and that's something that people really need to focus on. Every single system, every single operational system that you put in place within your company, is it improving the patient experience? And if it's not improving the patient experience, if it's not working for your clinicians, if it's not working for your employees, and if your investors are not getting any benefit from it, why are you doing it?
There's something that you said about, patient experience, how important it is in this process, especially when you think about appointment reminders, right?
Yeah.
If patients don't show up, you're really not taking care of them, right? How to prevent that. And often businesses operate in a reactive state, which forces that compromise. And I know even on our end, some of the signs that some of the earlier signs that we see are no-show, right? Yeah. No-shows rise. Patients are not showing up, and it can be multiple reasons why. Also, providers that fall behind on documentation. There's often a reason why is that happening as well. Patient messages are piling up and providers are not getting to them. So, that patient experience is also being put on a back burner. Referrals slip through the cracks. And then, if you look at the leadership, it flies blind because there's really no clean data. So my question to you is, how can leadership identify and measure this imbalance from your perspective, what you have seen at the practices?
I think you were just talking about it. What metrics are you actually tracking? Yeah. If you focus on only, how is our revenue growing? How many patient appointments are we seeing? And, what's happening to our margin? If you focus on only those three things, you're not actually seeing the full picture. When you're looking at patient appointments, are those new appointments? How many no-shows are there? How many recurring appointments do you have? How long have your patients been with you? And with physician documentation or clinician documentation, is it a recurring issue with one or two clinicians that is related to something unique to them, or is it a recurring issue and there's among a lot of clinicians, and is there something that needs to be addressed there so that they can actually do their jobs more efficiently and more easily. I just use the word as well, the word efficient, and people use that word a lot, and like, what do they actually mean by that? Sometimes by the word efficient, what they actually mean is, does it cost less?
Yeah.
And that's not really efficient, right? That's just, does it cost less? But is the process efficient, or are people actually having to go through too many steps to make something happen? Do you have turnover in your clinicians? Because if you have a lot of turnover in your clinicians, patients are also not going to like that. If you have these long-term patients and the clinicians start turning over, you're probably going to see patient turnover start creeping up as well, right? And so a lot of this goes back to, like, what metrics are you actually tracking? Are you tracking the metrics that matter, or are you tracking the metrics that are easiest to track? Because if you track the metrics that matter, that are core to what your clinical mission is, then you'll be able to notice all these patterns. And when you notice that a pattern for something that's not working, it's really important not to get stuck in the trap of the sunk cost. I talked to a CEO last week, and he was describing this whole, like, patient reminder process, an intake process to me. And he said, our patients don't really like it. And I said, well, why do you still have it? He said, oh, we spend so much money on it. But your patients don't like it. If your patients don't like something and it's really detracting from the patient experience, it's time to, start looking at that really closely and trying to figure out, is this the right process for us? Have we implemented the process correctly? Is the issue on our end, or is this not the right tool for our patients? And do we need to change something? Because every day that you continue to use a process that doesn't work for your patients is a day that you have invested in that process, because you have spent all day working on that process. So that's compounding the problem.
Yes, no, absolutely. And then one thing we have here at ClinicMind, something that we really focus on when we're building solutions, and I know it sounds very self-explanatory and very common sense, but a lot of organizations, or a lot of like tech organizations, forget about it. If you're not solving a problem, what's the point? Or, like, I've seen some solutions, they're solving problems you don't have. And then you have to start thinking, am I really having that problem? Is this nice to have? So something we constantly ask ourselves, like, we have to step back and think, are we solving a real problem? Like, what is the true pain? And are we solving? And if we're not, no one cares.
Yeah.
Move on.
Are we just creating a system? Are we just creating a system that's unnecessary? And that's where, that's not an efficient system, because it's not actually solving an issue, and it's just there, doing nothing.
Or it's not solving a real issue, right? Like, you can come up with an issue and that you didn't think you knew, or that there was actually an issue, but like starting building platforms and building solutions based on what's really happening in a community. What are patients really saying? Like, you give a perfect example. If your patients are hating your check-in process, why are you still using that check-in process? It's a problem, right? Why not shift it? Why not switch it into something else? We, like, here at ClinicMind, we have one thing we talk about often is practice growth as a service. So growth, in our opinion, is not a campaign or a quick fix. It is, as you mentioned, a compounding effect of operational systems that are working together to solve some of those pain points, but then also help practices grow. What does that look like from your vantage point?
I think sometimes people think, like, okay, now I'm ready to grow, and I'm going to put all of these new systems in place all at once. I don't think that that's the right way to go about this, right? I was talking to a CEO a couple of weeks ago who's exactly in that situation of, they've acquired the business, a long-term family-owned business, acquired the business, want to continue to grow the business. They need to upgrade all of their systems. But if you do it all at once, these systems need to be able to talk to each other. And it's really complicated to change everything all at once, because everyone needs to learn how the new system works and needs to be more efficient on how they're using it. You get into the problem of, are you fixing a problem that doesn't actually exist? Because a lot of these systems can do multiple different things, right? So I do think being really, a lot of people talk about in healthcare, in innovation, you have to move really fast and move really, really quickly. But when you move really fast and you move really quickly, a lot of times things get missed. And so I do think it's really important to move carefully. You can move fast, but you have to move carefully. Be really intentional about what you're doing first. Like, what is the biggest pain point? If you have a bunch of operational systems in place, which one is the thing that is causing the most issue? Tackle that one first, and then everything else can follow. And sequencing those changes becomes really important. But also, sequencing, who you're hiring. Do you need to hire from the top, or do you need to hire from the bottom up? Like, who are the people that you really need? Like, again, it comes back to, where are the pain points? Is there a system that somebody needs to own, as you grow, like someone else needs to be in charge of it, and who are you going to hire to be in charge of that? A lot of times I see, companies that grow, and then they don't put these systems in place, and then they start shrinking. Because everybody that is working on each of these systems gets burnt out and overwhelmed, and there aren't backup systems in place already to be able to catch up and kind of fix the burnout or fill in the gaps of the burnout. I think there's so much friction within the healthcare system that as these companies grow, if they can reduce that friction, they can make sure that there are as many systems in place as possible so that one system can feed into the next. I think all of those things are really helpful when a company grows. And it really helps reduce burnout across the whole company.
And especially if those systems, like you said, do not talk to each other. And
that is like a disaster. Yeah.
That is an absolute disaster when you have the fragmented even tools. And they could be great tools, right? We have some wonderful tools out there for us providers to use. But if those tools do not communicate with each other, it creates even more chaos and a fraction than it would be if you don't use any of those tools. But you and I talked about this offline briefly about technology. It really it's not the hard part. It's behavior change, right? It's people. So how do we help people in teams align around growth that serves care?
Growth that serves care. From a technology perspective. I mean, look, we're in an industry, just yesterday I asked for, census and patient data, and I received an Excel file with numbers typed into it, right? This is from, a company that I know. So we have that, and then we have other companies that have, too many systems. Just all of the technology because they think technology is going to fix some of the issues within the company. I forgot what your original question was, but I think from a technology perspective, it's really what is the right technology that is actually going to help your business grow? Because obviously this company that sent me this Excel file with census numbers typed in needs more technology. And this company that has so many technology vendors that, I don't really understand why they have them all. They're all overlapping with each other. They almost need less. Or different. It's not even less, it's different technology. And so it's what are the pain points that your company is experiencing? What type of technology would actually help you grow? And do those technologies talk to each other? If your EHR doesn't talk to your billing platform, you have a problem, right? You need those things to be able to talk to each other. Otherwise, you're going to have a physical person who's actually making the two of them talk to each other, which is a really cumbersome system. Being able to find out, what are the pain points? What can we actually address as we continue to grow? If we were twice the size that we are today, what technology would we need to put in place to make sure that we are as efficient as possible? Again, I use that word efficient, and this time I mean a simple, frictionless process, right? If we figure out what that is, then that's how you can really implement those different pieces of technology to grow.
But also, bring people on, like people, right? Like technology, that's one part, but then getting people through that change, bringing them on to work on the shared vision together, build that shared vision, and also providing like maybe small wins for them so they feel like it is actually contributing to change, because sometimes it's difficult. I think you pointed this out, like with technology, when you're incorporating a new technology, it is difficult to see change right away. It is difficult to see a difference right away from a technological perspective. But how do you bring your team on board with that vision, or that something needs to change? Because like even changing an EHR, it is probably one of the biggest changes for the practice. And it's difficult because people hate change, to do something different that they're not used to. And it takes time for them to see results. sometimes.
If you go back to the point, which is what is the product? The product is the patient experience. And if you go back to that point and you figure out why you're implementing this particular piece of technology and how is it improving the patient experience, then people start to feel responsibility towards it, right? Because they're implementing, like, it can feel frustrating every day that you're having to learn a new technology, but if you're implementing something specifically because it's improving the patient experience process, then it feels like you're creating an impact. So I think if you bring everything back to that, what is the product that we're actually creating in healthcare services? The product is the patient experience. If that's the product, how is this contributing to improving that product? And how is each individual person who has to implement it contributing to improving that product? And that's where if you track the KPIs specifically related to how is the patient experience improving because of this product, then it starts feeling like, oh, we're all connected and we're doing something that's actually helpful for the patient.
So showing that clear path to patient experience. So showing leaders, providers, admin, the clear path, how that change that they're going through will impact, hopefully positively. That's probably why change is being made, the patient experience. So that makes sense.
I mean, you said earlier, a lot of people get into behavioral health because they want to have an impact. They want to make a difference. They see a gap and they want to improve it. And that's not just at the, people who are starting businesses, right? That's all up and down the entire company. Usually people are in this space because they want to see that impact. It all comes back to what are we doing for the patient experience? So I think connecting it to that, and frankly, if you're trying to create a big technological change and you're implementing something different, it should be connected to the patient experience anyway, so it shouldn't be a big stretch to be able to show your team how this is connected to the patient experience, because it should be something that you're looking at in the first place. I do think also having team members that are at the right levels of your company is really important. A lot of times people try to hire someone either too senior or too junior, and as especially clinically focused practices, they have a tendency not to hire people at a more executive level, and then they don't have people that are looking at things from this perspective. How do we create systems that work together? How do we think about things from more senior level? So I do think it's important to have that executive team that can make these decisions, focus on that patient experience, and then that'll have a trickle-down effect.
Awesome. Yes, no, absolutely. And Vasanta, we could probably go forever on this topic, but this has been such a rich conversation. Thank you so much for sharing your expertise. And really the big takeaway for today is growth and care thrive together when systems and strategy align, right? Absolutely. You don't have to choose one or the other, and you really shouldn't.
You shouldn't, yeah. It's not that you don't have to, it's that you shouldn't choose, because if you integrate the two of those, that's how you grow sustainably.
Thank you so much. It was a pleasure.
Thank you for having me.
ClinicMind, your all-in partner for practice success.